The Zambian healthcare system comprises more than 3,000 registered public and private health facilities in 116 districts across the 10 provinces of the country. The majority of these are in unserved and undeserved communities. It is here that babies are delivered by midwives who often work around the clock, bringing bundles of joy to life, thereby saving the lives of mothers and newborns. According to World Bank Open data, in 2024, Zambia had an estimated 645,000 annual births with a total fertility rate of 5.3 births per woman. Midwives are skilled professionals who contribute significantly to the health of women, children, and families in Zambia. Midwives and nurses are key pillars to achieving universal access care, UHC, at all levels and achievement of Vision 2030 on health. In 2011, a group of midwives came together and formed the Midwives Association of Zambia, Maz, to provide intervention in maternal and neonatal health.
Midwives Association of Zambia, it is a voluntary association. Any midwife in Zambia can join. We also have what we call associate members who are non-midwives, but they have the interest of midwives.
The United Nations Population Fund, UNFPA, supported and funded the formulation of the Midwives Association of Zambia, Maz.
UNFPA actually saw the birth of the Midwives Association of Zambia. We supported its existence in Zambia and also supported its first and second strategic plan.
Over the years, Zambia has experienced a slow decline in maternal deaths and an increase in neonatal mortalities. It is worth noting that the maternal and neonatal mortality rates in Zambia are the highest in the region. This prompted the government of the Republic of Zambia to declare maternal mortality as a health emergency in May 2019.
So as Midwifery Association of Zambia, supporting Ministry of Health in reducing maternal and child mortalities. This is the plan which Ministry of Health came up with in May 2019, where they declared that maternal health is an emergency.
I would say that Zambia has prioritized the RAMCAN program. So RAMCAN stands for Reproductive Maternal Newborn Child and Adolescent Health and Nutrition. So there are two main indicators that we are targeting. So we have an indicator that talks about reducing maternal mortality to less than 70 per 100,000 live births by 2030. And we also have another target that looks at ending all preventable deaths of children under 5 to at least 12 per 1,000 live births.
The Ministry of Health, MOH, in collaboration with Maz, are committed to reducing these mortalities and also to improving the health of women, neonates, children, and families.
The 2020-2024 strategic plan was a plan, first of all, that was supported by UNFPA. So they supported the drawing of the strategic plan, and we put in quite a number of activities. And most of the activities that we put in there were the activities that were responding to the challenges that we are having in maternal and newborn health.
The main objective for the strategic plan was to reduce maternal, neonatal, and child morbidity and mortality, because these figures are very, very high.
The Midwife Association of Zambia, Maz, supports MOH in improving the health of women, children, and families, but also to reduce the mortalities of these vulnerable groups in society. In that regard, UNFPA, with support from MOH, funded Maz in the formulation of the Strategic Plan 2020 to 2024 as a roadmap to close the gaps in maternal health.
So for the 2020-2024 strategic plan, UNFPA supported Maz to develop the guidelines for the respective maternity care and also training, the initial training, the train of trainers in the respective maternity care.
So some of the strategies that we have employed as a ministry include partnering with other associations and other cooperating partners to come up with strategies and interventions that are critical to reducing these numbers. So one of the organizations that we are partnered with is the Midwives Association of Zambia, where we are implementing a number of activities with them, including capacity building for the midwives as well as other healthcare providers. We have worked on strategies together to ensure that the strategies are able to drive us towards the agenda.
In this documentary, we dive into the milestones achieved in the 2020 to 2024 strategic plan. The strategic focus of this 5-year plan was to improve the skills of midwives and nurses who attend to women and neonates in Zambia. One of the objectives of the strategic plan was to save the lives of mothers and newborns and contribute to better health outcomes of women and children towards achieving universal health coverage by 2030, Sustainable Development Goals 3 by 2030, and Vision 2030.
Maternal and child health is something that even the country is looking at as the main health challenge in Zambia. So maternal mortality in Zambia is very high, and at the time that we were drawing that strategic plan, we're looking at the maternal mortality, which was at 278 per 100,000 live births. So that, to us as Midwives Association, was something that prompted us to really put in activities that were going to respond to the reduction of maternal mortality.
In the past 5 years, Zambia's competent, well-supported and motivated midwifery workforce has delivered quality, equitable health services and contributed to the well-being of mothers, newborns, families and communities, which is a basic human right in Zambia and worldwide. In the years under review, contraceptive use increased from 35% to 70%.
Then the other thing was the use of contraception, increase the number of women utilizing contraception, because contraception is one of the ways in which a woman can be protected, because they have the ability to decide when and how they're going to have this child.
It is worth noting that Maz is facilitating training of midwives that is making remarkable improvements in the maternal and neonatal mortality rates in Zambia in the last 5 years.
So some of the targeted trainings that we have undertaken with them include the respective maternity care. Then others include the emergency obstetric and newborn care, which is EMOC.
We had put issues to do with training of midwives, to update them with skills to save lives, because we know the causes of these maternal deaths are preventable.
As an association, we have ventured in training of in-service midwives in early detection of maternal emergencies such as eclampsia, pre-eclampsia, and also how to manage them.
The beneficiary midwives of the capacity building can attest to the impact the training has had in their midwifery practice.
I want to say, talk about is mainly the benefits that as a person who has received training under Maz programs, I have benefited a lot. The one and most important one is the respect for maternity and neonatal care. This has been one of the major objectives that Maz had planned to achieve during the period of their strategic plan, and we have seen that they've tried by all means to train so much.
As a member of the Midwifery Association of Zambia and one of the beneficiaries as an in-service student, which was in 2023 up to 2024, we've learned a lot of skills. The skills that we've been trained is that our skills have been sharpened. Early detection of emergencies such as postpartum hemorrhage, detections such as eclampsia, preeclampsia, antepartum hemorrhage, obstructed labor, fetal distress. Those are the skills that we've actually learned.
I'm in-service doing midwifery program at Lukon, which is UTH. So this program started in January, and we are here to do practicals. We are learning skills, how to deliver a baby, how to save a mother who is going into delivery. So midwifery, this program involves a lot. So we'll start handling this mother as they conceive, or rather as they have their pregnancy. Come now to book, or to rather be seen during pregnancy. There are a lot of things that are involved. We'll rule out certain conditions during pregnancy and we'll be able to manage them. We'll talk about example of hypertension. We'll talk about diabetes mellitus.
Zambia has made tremendous progress in reducing maternal mortality rates from 252 per 1,000 for every live birth to 187 per 1,000 for every live birth.
So currently, Zambia has made some progress towards that. And when you look at our maternal mortality ratio, we have reduced from the 252 per 100,000 live births that we had in 2018 to 187 per 100,000 live births as at end of 2024 when we had our Zambia Demographic Health Survey. And then the child mortality rate has also reduced from 61 to 42 per 1,000 live births. When we look at our neonatal mortality rate, we have also reduced from 27 per 1,000 live births where we were in 2018 to 17 per 1,000 live births in 2024. So basically we are making progress, but a lot still needs to be done to ensure that we get to the Sustainable Development Goal target of reducing neonatal mortality to 12 or less by per 1,000 live births by 2030.
Mothers are happy with the services provided by Maz in reducing maternal and neonatal mortalities and the care given during pregnancy and childbirth at health facilities.
I'm very humbled to be here sharing my delivery journey. In all honesty, I would love to say these people are very kind and very helpful. There is no disrespect regardless of your age, whether it's a prime delivery, whether you're underage, maybe 17, 16, 15, they'll respect you regardless. I almost forgot I was in labor when I went to deliver my child because of the good conversations we were having with the midwives. And I highly recommend women who are planning to get pregnant to start their antenatal visits. The midwives are very kind.
I've been getting a very good support from the midwife and the nurses. And also, I would like to encourage each and every mother out there to start early antenatal, attending the meetings and all that. They are very friendly people, and now I've given birth to a baby girl. I'm very much happy.
The Zambia Association of Gynecologists and Obstetricians, ZAGO, is impressed with strides made by Maz and considers the association as the primary backbone of maternal health.
ZAGO considers midwives as the backbone of maternal health. So they are the first respondent, and for all the survival of our mothers and the newborns, we mainly owe it to the Midwifery Association of Zambia and its members, who are usually found in our labor wards, in our maternal child health units and neonatal units. Collaboration of a project which they were doing called Helping Mothers Survive Bleeding and Helping Babies Breathe. You may be aware that the bleeding after childbirth is the leading cause of mothers dying in childbirth. The other project we worked closely with was the review of maternal and perinatal deaths. In 2019, maternal mortality in Zambia was declared a public health emergency, and we were summoned at our Ministry of Health to come up with a committee that will be professionally reviewing maternal mortality and perinatal mortality at national level. And that's where we collaborated with Maz and ZAGO. its members and our members at Zambia Association of Gynecologists and Obstetricians work hand in hand.
To foster continuous personal development of midwives, Maz requires support from MOH and other stakeholders through endorsement of programs.
Some of the lessons learned, I think, during the implementation is that it's very important when government supports the activities. And we had quite some support from Ministry of Health. Endorsement of government with all the proposals that you're writing, I think is very important. So when they endorse, they take it as they own it. And so it's very important to be strategic and be able to speak to partners. I think networking is also another thing that I felt was a lesson learned.
The future outlook of Maz is bright as the strategic plan 2025 to 2030 has already been formulated, which includes the implementation of activities at provincial level, strengthening Maz, increasing strategic partnerships, and an effective incoming executive should carry the mantle forward.
The way forward, basically, for Maz strategic plan was to bring into fruition the midwife-led facilities. The association needs to work harder so that we raise more funds. We've seen with the funds that were raised and the stakeholders that came in the 2020-2024, we've seen how the maternal mortality ratios have started going down.
A call was made to collaborate with training institutions and regulators.
The training of a midwife is something that is very cardinal, because a decision that a midwife makes within a minute can mean death or life for this neonate and this mother. The Midwives Association should work hand in hand with the training institutions as well as with the regulators, so that we regulate who is being trained and who is being called a midwife in this country.
The ultimate goal is to have strong, healthy women, children, families, and communities in Zambia. For Maz 2020 to 2024 strategic plan to be successful, the association obtained funding from strategic partners such as UNFPA, Latter-day Saints, and JPIGO to fulfill the training activities. In addition, Maz raised funding from membership subscriptions and sale of Maz corporate shirts.
UNFPA has supported the Midwives Association of Zambia to revise their strategic plan. So we supported them to do a draft for 2025-2030 strategic plan, and also we are advancing some money so that they can finalize that strategic plan.
We also have the Latter-day Saints of Charity, the LODS. They have been funding us in building capacity in student midwives and also nurse tutors who teaches the student nurses. Lottery has also funded us where we were conducting trainings in helping mothers survive bleeding and helping babies breathe. The main source of our resources as an association is through the membership. Currently, we are standing at 1,000 plus members. The other way the association has been raising funds is through the sales of corporate shirts and also t-shirts on a yearly basis.
It can be said without a doubt that Maz is on the right path of progress in reducing maternal and neonatal mortalities.